Hey guys, just a quick update, I promise, on Friday, June 17th. Um, COVID, as usual. You know, the community level maps have changed quite a bit in the last couple of weeks. Right now, we have two counties, Chesterfield and Marlboro, that are considered red in the community level map. Now, that's not the one that we adhere to as a healthcare facility, but it's the one for how you should be thinking about your safety in your community life, so to speak. Chesterfield, like I said, Chesterfield and Marlboro counties are red. And when a county is red, CDC recommendation is that masks are worn indoors. That means when you're in Chesterfield and Marlboro counties and you're out grocery shopping or whatever, it's time to put those masks back on inside. I know everybody hates that. The other counties are all yellow, though, and that is a medium risk. So that is one in which you have to make your personal evaluation when out in the community on what level of risk you're willing to personally accept. And that depends. Many of y'all have some very high tolerances for risk. Others of you have older parents and grandparents at home and, are pretty risk adverse. You don't want to get them sick, infected, and possibly in the hospital. So, just an update on that. We are desperately trying to figure out how to, I don't know if the word is go back to a new normal or what it is. I hate that word, new normal. But we really are trying to figure out how to safely move forward in this pandemic era where we may never be back to normal. Who knows? Who knows what this virus is doing? It may not ever act like the flu virus. We don't know. There's a lot of experts that don't know. But we know we have to figure some things out. Particularly, we need to figure out how to restore our relationships and connectivity with each other, whether it's in our meetings, in our visits, in our events, staff meetings, other meetings that we have on a monthly basis, or whatever it is. We are trying desperately to figure it out. We know that life going forward will probably be a blend of working together both face to face and virtually. We'll figure that out also. We've got some new equipment, a particular piece of equipment called the OWL that really makes having a Zoom meeting very interactive and covering a lot of people so it doesn't look like the Brady Bunch wall as much. So we got to figure this out. And we are working on it. Like I said before, we are really fingers crossed and everything else crossed, hoping that we can have a staff meeting or staff meetings, plural, in August at some time. So sit tight. No, we're not just giving up. We are trying to work on this. But let me remind everyone we have a ton of free at home test kits. Use them. Folks, I used them myself before I went to one of these recent events that we've had, ribbon cuttings, even when we had the gatherings, the funeral and so forth, the services for Tim Brown. I tested myself before I went. And I tested myself a couple of days after I came back. Regardless, I'm hearing so many people say, oh, it's just my allergies. And then, poof, they are testing and they are turning out to be positive. When you're not testing and you don't know your status and you're out and about, whether it's at work or in your community or at home, you're infecting others. So this is such an easy thing to do. Get those test kits. Use those test kits. They are a very good weapon against minimizing the spread of COVID, which is what we need to do. We don't need to have as many staff as we have now that are on quarantine. So get those test kits, use those test kits. Um, just a couple of other things I did mention. In the past week, we have had count them, two ribbon cuttings. The first ribbon cutting was in Dillon. That was last Saturday on June 11th. Let me tell you something, y'all. That was an amazing ribbon cutting. You know, that building, we're sharing that building with DHEC, who is doing WIC on one side. But that is one of the most unique arrangements anywhere in South Carolina. So the head of DHEC was there, Dr. Zimmer, along with the head epidemiologist. You know, y'all know Jane Kelly, but she's the assistant epidemiologist. The head epidemiologist was there, Dr. Brandon Traxler, and also every single state regional health director was there. It was pretty awesome, kind of humbling, a little bit scary even, to have all these higher ups. In addition, DHEC had a lot of their other division directors there. So this is a big deal. But I want to tell you something else. The words that Dr. Zimmer said, and that I was hearing from so many other people, was a measurement of the extremely high esteem to which CARE South Carolina is held. And that's your work. That's because of who you are. That's because of how you have conducted yourself and how well and incredibly awesome you have been responding to this pandemic, whether it's for testing or vaccination or the monoclonal antibody infusion or whatever it is. You have knocked the socks off of lots of people locally, statewide. The state legislator there, Jackie Hayes, known us for years. You know, I know everybody thinks that glowing words are going to be said at a ribbon cutting or event like that, but these were more than glowing words, and it happened again just last night, Thursday evening, the 16th of June, at our Chesterfield ribbon cutting. At that ribbon cutting, we didn't have the DHEC people because Chesterfield building doesn't have that co-location, so to speak. But we had the local legislator, Richie Yao, there, the local politicians. Our own board member was there, Pat Hennigan, who is also a state legislator. And once again, incredible words and heartfelt words. Like Representative Yao said, where he counts on us. His family gets care from us. He knows the level at which we provide care, and frankly, is blown away. So, y'all, that didn't just happen magically. That happened because whether it's being in a pandemic or whatever, you guys have been incredible. The things you have done, the patients you have impacted either by testing or, like I said earlier, vaccination or monoclonal antibody infusion or just your day-to-day care has knocked the socks off of many, many people. You really are. You really are CARE South Carolina strong. Enjoy our little holiday weekend. It might be a little hot, and boy, did we ever have a storm last night. So stay safe, be careful, stay healthy.